All right. What's up, everybody? Good evening. Gonna do a triple check on my mic here. Make sure everything is what we want. Looks like it should be. Wonderful. How's everybody doing? Welcome. Hey, everyone. Welcome to another exciting episode of the Know Your Pharmacist Livestream. I'm your host, Dr. Joaquin Acosta, CEO of Pharmtrue. And tonight we've got a show that's both going to enlighten your mind and warm your heart. First up, we're diving deep into the front line of pharmacy, where we're going to unravel the alarming rise in overdose deaths from counterfeit drugs, according to the CDC. So it's a must-watch segment sponsored by none other than Pharmtrue, your trusted partner in pharmacist-formulated cannabis products. In our Tech Talk, we're going to be exploring the groundbreaking overdose detection technologies that are available and maybe what may be up in the future. Imagine a world where technology can save lives in real time. We're on the brink of that reality, and tonight we brainstorm how, guys. So, we'll get there, right? What do we mean? Like naloxone devices that are automatically going to administer opioid saving, opioid reversing drugs that are, we'll show you a little bit. Anyways, for our Herbal Wellness Corner, sponsored by High Horse, we're demystifying cannabis dosage forms and bioavailability. Something we continue to harp on, but following up on exactly right where we need to be. Whether you are a cannabis connoisseur or a herbal newbie, this segment will elevate your understanding to new heights. Our community spotlight, guys, we're shining on our Buck Cancer Gala. Today is the last day to grab your early bird tickets. So if you haven't grabbed those early bird tickets yet, now's the time. The link is in the description of the stream today, so you can grab that ticket. $65 for a single ticket versus the $75 single ticket charge starting tomorrow. So early birds, go ahead and snag that now. Anyways, this segment is brought to you by the Trichome Alliance, fostering education and advocacy towards green medicine culture, as well as the host of the Buck Cancer Gala and the Buck Cancer case study. So awesome. Last but not least, guys, in our Men's Health Minute, sponsored by Vado Speedway Park, we're discussing why women should be just as passionate about men's health. Trust me, you don't want to miss this. So sit back, relax, and let's collaborate on a journey of discovery and wellness. We're about to get started, guys, and I promise it's going to be both interesting and excellent. So first up, we got opioid overdoses. The CDC showing just published, drug overdose deaths with evidence of counterfeit pill use have significantly rose to historical levels. So again, it's insane. What is already known about the topic? Counterfeit pill availability in the United States is increasing. Drug overdose deaths are at historically high levels. So again, that's of recent, that's of now. We're still fighting this issue, and we are going to continue to fight it. So it's something that we need to talk about. I'm going to show you guys a little bit about that right here on this stream. Hope everybody's having a fantastic day. This is the CDC's newest publishing, guys, of their report. And, granted, they were consolidating this data from 2019 to 2021 about drug overdose deaths with evidence of counterfeit pill use. But looking at those trends, right, with drug overdose deaths being at historically high levels, that's insane, guys. I mean, the cartel theoretically were tackled back when Pablo Escobar and those guys got brought down. As anybody who's watched Narcos, right? That should have been one of the biggest drug ring busts ever. And all it ever did was maybe just one little bust that, is not really much of a ripple when you look at the world of illegal drug use. Guys, when you're looking at historically high levels of drug overdose deaths, now the problem is worse than literally ever. And here, counterfeit pill use in overdose deaths more than doubled from September 2019 to October, December 2021, and tripled in Western United States. Descendants with evidence of counterfeit pill use compared with those without such evidence were younger, more often Hispanic or Latino, and more frequently had a history of prescription drug use and misuse by smoking. So again, Hispanics and Latinos were, showing even more evidence of frequent history of prescription drug misuse and drug use. And this counterfeit overdose death is affecting who? Yes, exactly. Right? Hispanic and Latino population, as well as everybody else. But here in our, neck of the woods, guys, we are in the United States southern border, Las Cruces and El Paso, and you're looking at historically high levels of counterfeit pill availability and drug overdose deaths. So what does this mean, right? Talking about overdose prevention messaging that highlights the dangers of pills, obtained illicitly or without a prescription, encourages drug product testing by persons using drugs. So looking at this data is just insane. Drug overdose deaths are at historically high levels in the United States. Preliminary estimate of more than 105,000 deaths in 2022. All right, guys, we're looking at things like COVID-19 and the pandemic there. The war on drugs is taking 100,000 Americans every single year. Here, proliferation of counterfeit pills, which are not manufactured by pharmaceutical companies, but are typically made to look like legitimate pharmaceutical pills, frequently oxycodone or alprazolam, is complicating the illicit market and potentially contributing to these deaths. Counterfeit pills often contain illicitly manufactured fentanyls, illicit benzos, bromozolam, etazolam. Guys, these things are very, very potent. And what do those potent concentrations do? They cause overdose. And so talking about that here, our Pharmacist Frontline, why is that important today? Because, the CDC just came out with this study publishing this. And, here in New Mexico, we already know the issues that are plaguing the state. And you look at what are the availabilities now for, harm reduction, and how do we get, addiction services taken care of, right? Pharmacists have interventions, healthcare providers have interventions, nurses, community programs, everywhere has interventions for things like, the opioid crisis here in New Mexico. But again, it's insane, guys. Something that we can definitely address, I think, as a community. We do, absolutely share a responsibility to do something about this. Talking about earlier this week and kind of checking the boxes of the story that we're following too is, guys, Walmart, Rite Aid, and I'm sure there's plenty more, were already sued billions of dollars in opioid lawsuits this year. Walmart has $3.1 billion worth of opioid lawsuits. They're cutting their pharmacists' hours. They're asking pharmacists to voluntarily cut their hours now. And Rite Aid is going to just go bankrupt. So they're going to ditch out on $3.3 billion worth of allegations and then just do the Chapter 11. So, the effects of that opioid crisis from, not even 2010 to 2020 has necessarily even been realized. There was a lot of overprescribing. There was a lot of overdispensing. And we are barely just living in the heart of that problem right now, guys, when you really, really think about that, because the opioid overdose deaths are at an all-time high right now. Counterfeit pill overdoses. This is insane. So what can be done? The movie that came out about it right now with, I think it's Danny Trejo, right? It's the Danny Trejo, excuse me. I know there's a movie with him right now that's all about pills on Netflix and counterfeit pills and online pills. Anyways, regardless of if I can remember the name right now or not, I mean, this is really actually something to talk about because, why, not only is this affecting Hispanic and Latino population more frequently, 18.7 versus 9.4%. And we don't know, every confounding piece of data here, but guys, Latinos and Hispanics really, 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 we are the population of suffrage here when it comes to drug overdose deaths with evidence of counterfeit pill use. Right, guys, New Mexico, I know in northern New Mexico, it gets even worse than things that are down here in Las Cruces, right? Between Espanola and Albuquerque, guys, we are the drug capital of the entire universe, feels like. And not to sit there and, say that in such a negative light, but you know what I mean? That's what I'm getting at is, well, what can we do? Well, there's the awareness, suggesting how do we get drug product testing more available for everybody who wants to try taking pills, right? And who wants to do any sort of illicit drugs. There's products on the market, which we're going to talk about right now, that address overdose specifically, but there's not a lot of products live that are actually addressing the, testing and the validity of what is inside, right? Like the fentanyl tests, you can get those, but again, what are the accuracy of those over-the-counter fentanyl tests and things like that? It's interesting. Granted, they're out there, but it's, yeah. So that is our Pharmacist Frontline segment, guys, sponsored by Pharmtrue. Really, really appreciate you guys hanging in there and listening to us talk about the opioid epidemic all week. It is a big deal because it's a silent killer, something that we don't see too much. A lot of people can go in and out of incarceration because of opioid charges and get entrenched in a system where, maybe they aren't necessarily going to be able to get out of. And what can we do? We have to advocate for not only the alternatives, not only for the other healing medications, but the education that goes into this, the culture change that we really need to see in our communities to encourage the awareness and to find a way to stop the illicit manufacturing of drugs, just find a way to stop the illicit online sales of illicitly manufactured drugs, quit making it so available. So big problems to address there, guys. And I'm sure, when you look at the international market of drug manufacturing, it's probably going to be a lot harder to do because, of course, right, the United States is like the prime rib of drug money for the entire world. When you think about every single drug manufacturer, whether they're based in India, China, wherever it may be, they are taking the United States to the cleaners on the cost of these drugs. The United States is bearing, 80% of the world's opioid use, as well as, we have the most inflated drug prices in the entire world. And it's insane. So you look at the counterfeit drug crisis, that is also a ripple effect of the fact that people are trying to get by expensive other pricing. And granted, when, people are out there seeking opioids because they were prescribed it for back pain or something like that, this is not, is it the chicken or the egg? So those are still all kind of questions to keep in mind, but, things to still highlights. So moving on, guys, talking tech talk, talking a little bit about devices, guys, overdose detection technologies. And so we're looking at, how do you reduce opioid overdose deaths? How do you use technology to help with that? Well, things that are already out. Let me give you a little sneak peek. And again, there is this one from actually started in 2019. I'm going to show you guys a little video here. Researched by Purdue University, and this is pretty cool. So, boom, boom.
There's a wide availability of naloxone, which is the antidote to be able to essentially recover them in the event of an overdose. But a lot of times these patients who overdose are found alone, are incapacitated to be able to inject this life-saving drug themselves. We're trying to come up with a closed-loop solution that can automatically deliver an antidote. So the idea is to be able to measure the rate of respiration using some sort of wearable sensor, and then be able to use that as some sort of a threshold to be able to trigger release of the antidote that's going to be implanted underneath the skin. So you will have a antidote carrying with you just in case you have an accident. And then when the system detects that you're having some sort of respiratory failure, the drug will be released automatically to give you additional time to get medical attention.
The activation device is composed of battery, microcontroller, and the actual induction device. And what microcontroller does is get the signal from the ECG, your heart rate, and then it will turn on the activation device. And this activation device will give alternating magnetic field, which is very fastly, rapidly changing magnetic field. And then this magnetic field will induce heat in the metal piece inside the capsule. This capsule, which is kept with a phase-changing material, will heat up due to the stainless steel. And then when it reaches the melting temperature, it melts out and the drug component will diffuse out.
This approach is unique for opioid overdose because there isn't a automatically injectable drug delivery system. There's a system to make the injection of naloxone easier for the person who is overdosing, but if they're unresponsive, there's no way for the person to actually inject themselves. Right now we have a proof of concept device to be able to show that we can measure respiration, we can use a signal to activate the triggering of the drug release. We're trying to essentially mitigate any types of risk in case the device fails, because this would be a life-saving device and we don't want to have any kind of failure. So we want to have a lot of redundancy. We want to make sure that we have a very high confidence that this device will work at a time of need.
So pretty cool, right? Like basically just getting at, there are technologies out there. In this study that I'm showing you guys right now, these are some of the technologies that were a part of the study. And that's exciting because, guys, how do we leverage technology to aid in the places that are really hurting us the most? Like you think of this silent killer, the war on opioids. What can you do to help improve somebody's chances from an opioid overdose, somebody at high risk that might already kind of be, in those systems, again, of, at least today's kind of infinite loop, right? Where you're maybe incarcerated and out on the streets and back incarcerated, and you're using obviously opioids and using them, at whatever chance you can get. And in those cases, they're having a technology in there, a device that can help somebody stay alive. That's awesome. So that's what we're showing you guys. And I'm going to show you one more device. I'm showing you this study. It's a cool study. It's showing overdose detection technologies to reduce solitary overdose deaths. So the one I just showed you, from Purdue, and then we're going to jump into another device. There was one that they were researching, which was pretty cool for opioid overdose, but it ended up being more useful for epilepsy. When I was researching that, it was called Empatica, and that showed up in this study, but it actually ended up, really kind of pushing more into an epilepsy device. So that's a cool device, and we can talk about that some other day. But the last one is called this Hope Band, and the Hope Band is pretty cool. It's supposed to be a wearable that can, again, detect the oxygens levels in people's blood to see opioid overdose, because at the end of the day, what does opioid overdose mean? It means you're going to stop breathing, right? And you are just going to die from that. You're going to suffocate yourself. And, especially in, rural communities, anything else, people that are alone, it's a very promising, interesting point of view there for our substance abuse community and everything, so on and so forth. Hopefully technologies even continue to even improve even more than that, guys. So again, right now, all the best mechanisms there are as much as of a nasal spray that somebody else can give to you, which again, if you overdose by yourself, there's nothing else. And this isn't to suggest that people should be wearing these overdose pellets just to do it, or devices or whatever it may be. But for people who are in a vulnerable state, that's a very great opportunity for great medicine. So absolute shout out for that sort of technology, guys. Very cool. Moving on to our Enlightenment Hour, everybody. Talking about the power of tasty language. What does that even mean? So in Enlightenment Hour, I'm showing you guys a little bit more Stanford relevant research here, talking about reading between the menu lines. Are restaurant descriptions of healthy food unappealing? So again, it's actually a study that's out there. And, this sort of psychological curveball here is something that I like to talk about in the Enlightenment Hour, because, why is it when you go to a restaurant that the, juicy, delicious bacon burger has the most well-written description, right? Or whatever it may be on the menu. And, there's something behind that. So you're looking at the study here, and you're looking at something that a Stanford researcher here, Brad Turnwald, and his colleagues, he was looking at restaurants used less appealing language to describe healthy menu items rather than describing other standard menu items. So as a result, people likely avoided the healthy menu items. And so the researchers asked, what would happen if you flipped the script and used more attractive language to describe healthy foods? Think about this, right? Well, answering the question, Turnwald's team conducted an experiment in a college cafeteria that serves about 600 diners during lunch. Each day, they named the main vegetable dish one of three ways: the healthy label, low sodium carrots, or lighter choice beets; the indulgent label, twisted citrus glazed carrots, or tangy lime seasoned beets; the basic label, carrots or beets. The researchers then discreetly measured how many diners chose the vegetable and the total weight of the vegetable that diners consumed. They found that 41% more diners served themselves the main vegetable when it had an indulgent label than when it had a healthy label. And 25% more diners chose the indulgently labeled vegetable than the basically labeled vegetable. Those findings suggest that labeling vegetables in tasty and exciting ways can lead to more people eating them. Again, why that works: people typically assume that nutritious foods do not taste as good as unhealthy foods. Food marketers confirm this assumption when they use bland, boring, and depriving language to describe healthy food. Think about it. But when healthy foods, on the contrary, have sensual, fun, indulgent descriptors, people actually do give them a try, and many learn that they like actually eating healthy. So again, even to your restaurant peeps and people like that, why are my healthy food items not selling? Maybe think about how they're titled on the menu. And most people probably already do think about that when they're running their business, and I completely understand. But there are different things in our community that we can do to help lower our diabetes rates, guys, and maybe something about understanding how we label our menu items and thinking just how unappealing these may feel and may be, right? Literally just based off the naming and the word. So it's pretty cool, pretty interesting. I'm going to link you guys to the instruction for anybody who wants to see that resource. It shows you how to break down all the different kinds of examples of indulgent and the different kinds of descriptions of ways to do vegetables and things of the mix. So it's pretty cool because you look at what dish you want to promote and showing you guys the toolkit. I'm going to just quickly kind of show through this. So select a healthy dish to promote. And I'm showing this on the screen. Boom, boom. Toolkit users should focus on giving edgy descriptions to healthy foods that can benefit from taste-focused language the most. Those include vegetables, whole grains, legumes, fruits, and plant-based entrees. Foods like pizza, burgers, and fries enjoy rich labels and don't need to be described differently. So making the dish taste good. Again, naming raw and unseasoned Brussels sprouts, spell binding, or bland eggplant exciting may backfire. Diners could feel deceived. So prepare delicious veggies and label them that way. Select fresh ingredients with complementary seasonings. Best edgy veggie dishes often include 2 or more fruits and vegetables to build flavor. So they even give you examples of edgy labels. So if you wanted, examples here, edgy veggie recipe ideas with labels: twisted citrus glazed beets, sesame garlic roasted broccoli with creamy tahini sauce. You're looking at the actual words that go into it. How many different ways can you spin carrots roasted with olive oil? Caramelized slow roasted carrots, mouth-watering slow roasted carrots. Already makes you hungry for that, just thinking about that. So clicking through those steps, about even if you wanted to do this recipe at home to try to kind of train the vegetable habits, right? Where your whole team could be you and your family, or you and your workplace, or wherever that might be. So again, you can look at how to brainstorm an edgy name for a dish. And this is cool. I like the ideas. And then again, more labels for spicing it up. Carrots, juicy, slow roasted rotisserie baby carrots. Again, how many different ways can you make that just sound delicious? So again, for people who have or have any interest of actually going through that, you can actually show the whole thing. So that was fun. That's our Enlightenment Hour, guys. Hope everybody enjoys the mindset shift, perspective shift, things we don't think about there each and every single day. Most days we just think about what's been pounded on us all day long. Cool, guys. So moving on to our Herbal Wellness Corner, sponsored by High Horse Cannabis Company, guys. Pumped up. High Horse Cannabis Company going to be out this weekend at the New Mexico football game tailgate. Go catch them out there. Go Aggies. It's going to be a great weekend. talking about bioavailability and dosage, guys, when it comes to cannabis, things that continually need to be harped on. Do I feel like some days I'm going to just say this until forever? Yeah, but maybe not, because it always needs to be heard. So when I'm talking about here, absorption, distribution, metabolism, and excretion, when it comes to bioavailability and how cannabis and different dosage forms of cannabis work, thinking about this so our consumers, our advocates, everybody in the industry can have a better idea of how to use it safely. So starting first things first, we were talking a little bit about inhalation this week, and I know we were giving some examples of 2.5 milligrams of cannabis can be literally like a tiny puff of anything 20% and the tiniest, and that would be enough of THC percent in an inhaled dose to cause somebody to get high. Something that a lot of cannabis users do not want to feel, psychoactive effects from THC. So, what are other recommendations in the time for how to prevent that? Well, knowing if a certain dosage form might last a certain amount of time in your body, you might actually find that to be a useful situation there, right? So, right, bioavailability can range based off of different types of, inhaled cannabis, 10 to 60%. How deep are the inhales actually taken? What is the duration of the breath being held, with the inhale? And also the temperature of the vapor even plays a factor. So all of that plays a factor on the 10 to 60% bioavailability when using inhaled cannabis. But again, proper technique, that onset of action is anywhere from 0 to 10 minutes when you are inhaling cannabis. The duration can last, anywhere from 2 hours to 4 hours, and it's going to vary from person to person. But it's important, right, to teach the proper technique, to draw, right, the breath almost like a rescue inhaler, get a good deep breath, get the full bioavailability. I'm waiting 5 to 10 minutes between inhalations, especially for those who are just finding their dose, just starting low and going slow. You don't understand how important that is. So again, it's easy for the people who have been using inhaled cannabis for the longest periods of time to not have to understand that. But again, always a good reminder for those who do use inhaled cannabis that the duration that it's held in, is going to affect the bioavailability there, as well as the temperature of the, consumed vapor, smoke. But inhalation for most people does give higher doses than really the therapeutic thresholds really need. And it's really hard to dose. So, recreational cannabis use can be more on the borderline inhalation side. But no, it is needed for medical use as well. It's probably needed for more breakthrough pain, breakthrough, use. And if you're using vaporizers, you can actually dial in your doses on the medical side. So again, if you wanted to control your dose, measure that, get your full dose, you'd use something like a vaporizer, like a volcano vape. You guys know what that is? I'm going to share that with you on the screen here. So it's not like rolling it up in a joint or putting it in a bong or in a pipe, but actually using like a vaporizer. So again, I'm sure you can get it somewhere in town or wherever this is going to be. But I'll show you the product just so, people know you don't always have to be rolling your joints or doing these traditional methods. These are expensive, but it gives you the ability to put the temperature, dial that in on your cannabis, turn it into straight up of a vapor, got a fast heating process. But that's why most people don't use vaporizers, because they are quite expensive for the real good ones. And I think the difference in the quality is basically all of that. So keeping that in mind, guys. Herbal Wellness Corner, we're talking about dosage forms, talking about inhalation. So again, quick inhalation, 0 to 10 minutes, onset of action, length lasting from 2 to 4 hours. Moving on to oral dosage form, onset within 30 minutes to 2 hours. Absorption is increased almost 3 times with a high-fat meal. I think everybody knows me saying this. And again, it has longer, more potent, analgesic activity. So those looking for that pain control, right? Those looking for that sustained release option. Let's get off the morphine ERs, right? Let's get off the OxyContin. Let's look at long-lasting pain relief. Let's get off of the ibuprofen, stop blowing up the kidneys even, right, guys? Everybody's looking for one more option. That's what it's talking about. Oral administration of cannabis, whether you're using a 1-to-1 of CBD and THC, that gives you an inflammatory, and a nerve pain, potent little combo there, sustained release with a high-fat meal. It's gonna, guys, I'll put that any day for my patients over 800 milligrams of ibuprofen all day long, or 10 milligrams of morphine Q6 hours, whatever that might be. So again, oral administration, guys. THC, you want it, in that mealtime. You do want CBD in the mealtime too with edible products. And just keep in mind, again, guys, the elimination of that product when you do take this sustained release products is a little bit longer than, inhalation. So how long can that be? 8 to 12 hours. And keeping all that in mind. Always got to advocate. But guys, cannabis can be, processed through the breast milk, through the placenta. It is a lipophilic substance. So, it can, again, for our pregnant women, pass through there. As much data as we have in the development and, the way it affects children, we do not. So the data is not put me in favor of saying to recommend it, right? People want their options, and there's people who there's resources for options, right? But the data right now doesn't just give validation there. So looking at dosing, guys, and considerations in dosing and self-titrating and what that even means, you taking control of finding your dose, starting low and going slow, right? How do you actually, sensitize yourself into using cannabis? Not many people want to start off using cannabis, getting, extraordinarily intoxicated and feeling floaty and euphoric or whatever else that might be with, THC. You want to find a sweet spot, right, where you avoid the adverse drug reactions and everything there. You find the sweet spot, pain control, wellness, whatever that might be. Anecdotally, subjectively, what works for you. That's where that comes in mind, and you have to keep that in mind when you're thinking about dosage form versus, right, the actual elimination and the absorption and the administration of it all, and putting it all together and the wheels in your wheelhouse, and, using cannabis efficiently, responsibly. It's great. So that's our Herbal Wellness Corner, guys. Always informing. Thank you. Sponsored by High Horse Cannabis Company. Moving on to our community spotlight, everybody. Highlighting our Buck Cancer Gala, everybody. Today is the last day to save $10 on those tickets, so I highly advise anybody who plans on going to this event, which is going to be awesome, the gala, to get that ticket now, $65 versus $75. It's going to change to $75 tomorrow, guys. So, it's going to be a suit and tie, dress your best evening. Going to get a password to come in. It's going to be fun. Awesome Italian style dinner place, supporting our Buck Cancer Initiative, which we are still strongly recruiting patients for, guys, for sure. So if you got people that that want to be something part of something groundbreaking, something bigger than themselves, send them our way if they have cancer. And we can help try to heal them and heal other people by doing this. So again, get those tickets, $65. Save the $10 on all that. You got the QR code right up on the corner. You can scan that, or you can hit the link in the description to get those tickets cheaper. We are still looking, guys, for sponsors, dinner sponsor, entertainment sponsor, cocktail hour sponsor, the whole deal. Really appreciate you guys. It's going to be a really great night. It's a Thursday, September 21st. It's going to be the best time of year to get, go out and have a good time. When do you get to do things like this, in town, especially in Las Cruces? So Las Cruces, El Paso, TRC, Deming, Hatch, all you guys, everywhere in between, few and far, from sea to shining sea. Come check us out, Buck Cancer Gala. It's going to be a great time. But get those tickets. Save the money now. If you're going to plan on spending it anyways and you have it there to spend, it's just the better thing to do now. And, of course, we will still have them available after. They're just going up to $75. It's going to be a cool night. I'll show you guys a whole lot of stuff. It's going to be awesome. Moving on to our Men's Health Minute, guys, before we close this one off. Tonight, talking about Men's Health Minute, we want to actually talk a little bit about why women should be passionate about men's health. So looking at this, 58% of women aged 75% or older have experienced the death of their spouse, compared to 28% of men. So most of the men in their age bracket, were still married. Elderly widows are more likely to live in poverty even if they weren't poor before their husband's deaths. These stats paint a bleak picture of what's supposed to be your golden years. So ladies, again, get a couple more years out of that meat sack of a man of yours and listen up. I'm just kidding. But again, because statistically you are more likely to outlive your spouse, and, statistically you're more likely to experience poverty and, terrible things after that. Not to put it in a fear-mongering way, but just to try to, combat that. You can help your partner get to that point of, hey, take a look at actually seeking medical attention, especially when you need it, but getting on those, routine screenings, just like a car maintenance. Get in there. There's a schedule for you, right? Find a way to get health insurance. Be conscious of the access, how to do it. Ask those questions. It is a shared responsibility. Again, so, women looking at how can you learn a little bit more about health risks men face and early signs and symptoms of problems, guys. Watch the show every day. I'm just kidding. Or, check your resources. Talk to your man. It's a good idea. You can really help him live a couple years longer, because more likely you're going to be living that long anyways. Just looking at the facts, guys, not trying to sit here and, make fun of ourselves by any means. Anyways, women, you can encourage your men to go to the doctor, get the regular screenings, work together to set a good example of healthy living for children and proper nutrition and exercise, guys. Go play in the mud, be outside, be together, do all those fun things that we already know. So we put that all in a little pot, stirred up, and all of a sudden you got August 31st, last day of August, stew for the Know Your Pharmacist Livestream. That was fun, guys. Hope everybody has a good, wonderful rest of their evening. We will see you guys tomorrow for Friday, September 1.